Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, what are the symptoms of right ventricular failure? In right ventricular failure, the patient will have peripheral edema. There is abdominal distension is seen in the patient with jaundice. These are the main symptoms of right ventricular failure. Then, what are the signs of right ventricular failure? Right ventricular failure signs include there is raised JVP is seen with edema, ascites, and tender hepatomegaly is seen in these patients with jaundice. Now, why are these seen? This symptomatology is mostly completely different from the left ventricular symptomatology. Now, why is it so? Fine. So here in right ventricular failure, now there is right ventricle is it is difficult for the right ventricle to pump the blood into the pulmonary artery. So as a result, because it is difficult for the right ventricle to pump the blood into the pulmonary artery, now there is pooling of blood is seen in the right ventricle. Now as a result, it causes back pressure into the right atrium. So the right atrial pressure will increase, and then there is back pressure is seen into the veins. Here we have inferior vena cava and the superior vena cava. Superior vena cava and the inferior vena cava. Now, because of this increased blood in the right atrium and the right ventricle, actually the right ventricle has to pump the blood into the pulmonary artery. Now, the right ventricle is not able to pump the blood because of the failure. So, as a result, there is increased blood in the right ventricle. Now, right atrium tries to give the blood to the right ventricle, but obviously the right ventricle is already filled with the blood. So, right atrium has no chance to give the blood to the right ventricle. It pumps some of the blood, whereas some of the blood is left in the right atrium itself. Now again the superior vena cava and inferior vena cava tries to pump the blood or give the blood into the right atrium, but already the right atrium is filled with blood, so there is increased pooling of blood is seen in the veins. Okay, that is in superior vena cava and inferior vena cava. If you remember, the inferior vena cava receives a part of the circulation from the portal vein. The portal vein is right portal vein and left portal vein, and this portal vein goes to the liver, right? So as a result, there is increased blood in the inferior vena cava, there is increased blood in the portal vein, there is increased blood in both the sides of the portal vein. So there is hepatic congestion or increased blood in the liver, which is called as hepatic congestion is seen in this case. So because of the increased blood in the liver, you will see the liver starts to swell. So there is tender hepatomegaly is seen, and obviously jaundice is also seen. So jaundice is seen in the patients. Second, now in the veins and in the peripheral veins, we will see the leg veins. In the veins in the leg, there is increased pooling of blood is seen. So because of increased pooling of blood in the leg veins, this blood which is flowing in the leg veins, the fluid will go into the interstitial space. Thus, this is responsible for pedal edema. Even in the abdomen, in the mesenteric veins also and also portal vein, there is increased blood. So as a result, the fluid starts accumulating in the abdominal cavity, resulting in ascites. So we see ascites and peripheral edema of the legs is also seen. And why is there raised JVP? Because there is increased pooling of blood in superior vena cava. Superior vena cava receives its blood supply from the jugular venous vein, jugular venous circulation. So obviously there is increased blood in the jugular venous circulation. So there is increased JVP is seen in the right ventricular failure.
thank you and thank you for watching.